Dr. Phil?
This is going to be a changing day in your life.
The Dr. Phil Show.
Hi everyone, I'm Dr. Phil, and today on the Dr. Phil Show we have a special video from our lovely Canadian teen pop sensation, Laura O, regarding her relatively new diagnosis of Crohn's disease. To begin, for those of you who aren't familiar with Crohn's, it affects the digestive system. It's a chronic inflammation of any part of the gastrointestinal tract from the mouth to the anus. However, it mostly affects deep within the tissue of the intestines and rectum. Now, let's take it to the video monitor.
Hi guys, it's Laura O. I know it's been recently published that I have Crohn's disease, and I would just like to share with you guys a little bit about what's been going on in my life regarding the disease. With my case, it's affecting my ileum and my colon. My small intestine, which is usually responsible for absorbing nutrients, is inflamed and has lost its ability to absorb nutrients. This has resulted in an unhealthy weight loss for me. Not the kind of weight loss most celebrities achieve by choice, though. The large intestine's water absorption functions also become impaired, and ulcerations of the colon may also develop. The disease has put quite the burden on my life, as I now go through days when flare-ups are so bad that I can't go to the studio to record a new album, or that I'm glued to the washroom. But then there are other days when my medications seem to be really working, and symptoms are less active. I'm currently in bed resting because I had a really bad flare-up period a week or so ago, which sent me to the hospital. But the doctor's given me some new medications to take, and I now seem to be doing a lot better. I recently wrote a new song about my experience, and I wanted the music video to be premiered here on Dr. Phil. So here it is. I hope you enjoy it. Thanks, guys. 2 a.m. I wake up to abdominal pain, ran to the washroom, had diarrhea with blood it contained. Doctor told me Crohn's disease he must test me for. Colonoscopy and biopsy they did perform, viewed my colon through a camera and took cells to observe with a microscope. This test proved 70% accurate. They also used an MRI and a CT scan too, as they best show inflammation with a 3D view. My blood test proved positive, showed high white blood cell count. At 21, I was diagnosed with Crohn's disease. Oh, Crohn's disease. Confused how I got such a disease. Doctor said the exact cause of Crohn's is not known, but a theory exists. Our immune system reacts oddly, mistaking material for invaders, and will attack them, causing white blood cells to collect in infected tissue, causing inflammation of the GI tract. Its guess genetics play a factor also. But I cry when Doc says that there's no cure for Crohn's, just points when symptoms are low and points when they have grown. But if treated, we'll stay healthy and live long lives. Without treatment, it can be life-threatening. Having Crohn's disease. Oh, Crohn's disease. There's a light at the end of this tunnel, because there's still treatment to reduce symptoms and inflammation. Medications, antibiotics, corticosteroids, anti-diarrheal too. Doses of medications depend on the condition of the patient and the doctor's requests. I take large doses, 'cause I'm not yet in remission. Surgery is a second alternative option for more serious cases or problems such as fistulas, abscesses, or bowel obstruction. But despite the chronic symptoms and how it's changed my life, I keep writing my song, keep living with little strife. It's a lifelong challenge I'm willing to take on, living with Crohn's disease. With Crohn's disease. Oh, Crohn's disease.
That's right, folks. You've heard it here first. Crohn's by Laura O. Have a great day.